Um, well, I'll just jump right in. Thank you all for joining today. Uh, Today's webinar is AI Trends in Healthcare in 2025. Very excited to dig into this topic. My name is Kavi Gol. I'm a Vice President of Product Management at Innovaccer. I'm going to be moderating today's panel. At Innovaccer, we're bullish on the positive impact that AI can and will have over time on uh, physicians, clinicians, administrators in the healthcare industry. But there are a lot of questions to think through. Where should people be investing? When? What are the risks? How to manage them? So that's what we're going to be drilling into today. To help us reflect on this moment and how to approach it, got two excellent panelists joining me to talk through some of this together. First, Michael Abbott. Michael is an advisor to Innovaccer and a heavy hitter in the tech industry with executive experience at a lot of companies, spanning many industries, General Motors, Apple, Twitter, Microsoft, and more. Would love for you to take a moment and kind of introduce yourself.
Thanks, Kavi. Hopefully, you all can hear me. Comcast seems to be having a little bit of a challenge here. Great to be here. As Kavi mentioned, I have a background in kind of varying small companies, started companies like Composite Software, worked at Microsoft, early GM of Azure, and as you mentioned, kind of Twitter, as well as most recently Apple and then GM. So kind of seeing, companies big and small, especially over the last, 10 or so years in particular of how they've addressed some of these opportunities in AI and machine learning. So thrilled to be here. Thank you.
Uh-oh, did we lose him?
We may have lost our trusty moderator.
Uh-oh. Well, maybe I'll make a few comments and ad lib. So my name is Eric Jackson. I'm a pediatric anesthesiologist, and I'm the Chief Innovation Officer for Nemours Children's Health. And by way of background, my experience is primarily coming from academia. I did have a role with a med tech firm that serviced about 200 million patients a year in the medical device side, pulse oximetry. And so thinking about artificial intelligence and unintended bias, all a variety of these things were front in mind. And in the role that I have now with Nemours, we're constantly thinking about how do we create the healthiest generation of children. Our motto is well beyond medicine. So we're not just thinking about, we're thinking it through the lens of social determinants of health. How do we interact with the community? How do we interact with, for example, school-based health centers? How do we staff them? How do we, our kids with chronic illness, how do we help them? How do we help parents? How do we understand the entire patient journey? How do we leverage telehealth services for patients? So these are some of our principal concerns. I'll pause there and see if our Innovaccer colleagues have, they may be experiencing a technical issue.
Yeah, unfortunately, my internet connection has gone down to the perfect embodiment of Murphy's Law. So I'm hoping that I'll be online from here on out, but it's been a little spotty for the last few minutes. Thank you, Dr. Jackson, for jumping in and sharing your introduction as well. Could we get to the next slide, please?
So just briefly, in terms of describing the Nemours system, our institution was started by the DuPont family. That is the DuPont family you're very familiar with. It's a heritage family that dates back to the early 1800s in American history. They got their footing from smokeless gunpowder, if anyone's curious. So we have approximately, as you can see on the slide, over 1 million, almost 2 million patient encounters a year. We employ around 900 physicians, and we have, in terms of overall size of our enterprise, about over 9,000 FTE associates. Of note, we have one of the top orthopedic and cardiology programs in the country, according to U.S. News and World Report. We're very proud of that. And also we have one of the top, or the number one trusted resource in physician-reviewed information and advice on children's health through our Kids Health website, which is licensed to peer institutions throughout the country with over 75 million visits. So it's a source of truth for patients and clinicians as they're interacting with families that have these various clinical conundrums and would like to have user-friendly content that's accurate. So that's what we're very proud of that. With that, I'll pause.
Yeah. Thank you so much for that, Dr. Jackson. I'll do one quick digression because it's timely. Some of you may have seen this already. As of today, this morning, Innovaccer has announced raising a series.
Uh-oh, I think he's experiencing another technical issue. Do we want another member of our Innovator team to maybe step in while he's resolving the technical issue?
Sure. Sure. Sorry about that. There seems to be a technical error on Kavi's part, but as he was mentioning, we have an exciting news that goes out today. Innovaccer has closed its Series F funding, raising $275 million. This round has been led by a couple of our customer partners, KP, Banner Health, and existing investors, including B Capital Group and many more. This news is all over the internet today, so would request everybody on call to spend a few minutes after this webinar reading this news. I think Kavi is back here. Kavi, do we have you back?
I'm back. Sorry about these drops. I just got a text message from Comcast explaining that I may be experiencing an outage. I think we've all noticed at this point. I'm gonna keep going, but maybe Rishit, I'll tag team with you. My connection continues to be as spotty as it's been.
Sure, let's go ahead then.
All right. So just laying the context a little bit. Can you all hear me at this moment? Are we okay? Am I back on? Great. Innovaccer has put together a survey to get a poll of trends in healthcare. We've gotten input from professionals,
I think our other colleague may want to step in because he seems like he may have a better connection.
Yeah, no worries. So as Kavi was mentioning that we have put together a survey across 120 healthcare professionals and 70 unique organizations across the country. And based on that survey, we bring to you today's webinar where we shared a couple of insights of how AI has penetrated into the market in 2024. What are the key insights that we have from the survey report? What do we have in store for AI in healthcare for this year? And what are a couple of steps that can help your organizations for a successful AI integration? I would also like to mention here for all the attendees that if you have any questions, you can utilize the Q&A box to drop in your questions. And by the end of it, we'll pick those questions for our speakers. So let's get into it. How has AI penetrated the healthcare industry in 2024? Our survey says that 71% of healthcare professionals feel that it has well been penetrated in the AI assisted documentation part. 49% feel it has helped them improve workflow automation, whereas 41% feel that it supports their clinical decision making. Dr. Jackson, why don't you comment on this? What are your views about how AI has helped the industry in last year? Uh, Over to you.
Well, thank you. I think the one of the perspectives I think that's worth mentioning, and I'm going to take advantage of the connectivity issue because one of the things we think about on the healthcare side and is our redundant countermeasures because of the fact that we have a facility in Florida that experiences very bad weather, and we've had to create a logistics center, which not only does weather prediction for our Florida operation, but also oversees patient care in both of our major healthcare facilities in Delaware as well as Orlando. We have cameras in all of our rooms. This predates 2024, but we are now starting to think very deliberately about how do we include artificial intelligence in that application. So now we're in the process of upgrading to two-way cameras that can listen through ambient listening as well as deliver sound, and also algorithms can be embedded that can monitor patients in their rooms. This we think is just as an example, is a enhancement for workflow in terms of nursing, in particular, virtual nursing. It allows patients to be surveilled while the nurse may physically be in another room with another patient and still be able to interact with a patient in a timely fashion. So I think 2024 is an era where many healthcare systems are starting to implement and create policy around how to implement this exciting technology. We're on a learning journey as an industry. Our default expertise is not computer science. However, we do have very robust information technology experts within our system. How do clinicians interact with this technology? Those are the kind of things that we're thinking about right now.
Interesting. Thanks for sharing that, Dr. Jackson. As we mentioned, a couple of key insights that we have from our report says that in 2025, healthcare professionals feel that it is going to further help them improve and take off the load doing the administrative tasks and improve the workflow optimization, help in enhancing diagnostic accuracy, and help in electronic health records management. Uh, as we move into discussing what is in store for AI in 2025, Michael, with your experience of working across organizations like Apple and Twitter in the past, why don't you tell us how do you see AI penetrating into the healthcare industry, and if there are any parallels that you can draw between enterprise technology and the healthcare industry?
Sure, I will try my best. Thanks. So I think, one of the things that, for those of you who are customers of Apple, know that Apple puts in a very high regards and effort around privacy. And obviously, in this area, in healthcare with HIPAA, et cetera, there's a lot of concerns and considerations there. I think, in particular, and this launched with iOS 18, one of the things that my team helped build and launch was called Apple Private Cloud Compute. And what that did is enables Apple to work with your data off the device, but at the same time, retain the security posture and the privacy posture that the company has. And so I think confidential computing in particular in 2025 and the coming years is going to be big in a lot of industries, in particular in healthcare, for just sharing of data and working with data in an anonymized manner is going to be critical. I think that when you look in the enterprise today in AI, I think there's a lot of companies that are outside of tech working on where are the best places to apply this technology? And so I think companies are still trying to figure this out. I think there's various kind of ideas of how the applications could play, but I think as I said, the privacy and security, I think in particular, are really, really important.
And if I could add, the FDA this week announced Monday, if I'm not mistaken, they put out guidance for medical devices for artificial intelligence, as well as artificial intelligence in general, for public comment. This has a tremendous, in terms of guidelines and guardrails and how we should be thinking about using this. How do we manage bias or defend against bias and that sort of thing? So that's open for public comment as of Monday. And so healthcare systems are aligned with that.
I think one of the other pieces too that maybe you don't kind of see enough in the press is one of the challenges in AI right now is model evaluation, and really identifying how well the model is. And I think as we get into areas like healthcare and specific domains, you need domain expertise to do that model evaluation. And I think that's going to be an area where there's going to be a lot of investment in, because if we can't understand or have a metric for how the model is performing, there's really no way to improve it.
That's a very good example. Mike, one of the things that I think that relates to that, if I could take advantage and use a pragmatic example, is pulse oximetry. It was found to underperform, generally speaking, in patients with significant levels of pigmentation. And to the point where the clinicians were seeing during COVID, occult hypoxemia, for example, where the sensor was reading normal when indeed they were having experiencing low saturations, which translated into, looking in terms of large databases, increased morbidity and mortality. And so the question became, what was the existing guidance? And it turned out the FDA didn't really have sufficient guidance for all skin pigmentations. And the reason that's important is that the device shines a light through the skin and so forth. So now the FDA is really stepping up to provide proper guidance so that developers can appropriately calibrate their algorithms to serve a broader community and not have unintended harms. So I think you're spot on.
Interesting. Thank you for sharing that, Dr. Jackson and Michael. As we move towards what is in store for AI in 2025, 4 pointers come out to be standing out. The use of AI in patient journeys, operational efficiency, as was the case in 2024 as well, early disease detection, and streamlined EHR management. Dr. Jackson, with your experience of working at Nemours Children's Hospital as Chief Innovation Officer, what aspect of this do you align with, or are there other sections in patient care that you think AI could benefit really from?
Well, I think all four of those points are very relevant. I'll just very briefly give some examples that we're experiencing. So often early adoption for these novel technologies tends to play out, this is just my cursory observations, in terms of operational need and then diagnostic need. And the community that excels in medicine, I believe, in healthcare, is radiology in terms of early adoption of tech. So in terms of early disease detection from a radiographic standpoint, you have millions of images. So you can train an algorithm to evaluate those images for various diseases and add tremendous efficiencies, because it turns out there's a human constraint if you think of it through a human factors perspective. We can only be so good at it based on our biology. So having a algorithm can actually get us to a higher degree of accuracy in terms of evaluating those images. And pediatrics is a little tougher, because a 1-day-old is very different than a 1-year-old, which is very different than a 10-year-old. And so the algorithms have to really be sophisticated to understand the difference between a bone that's growing versus a bone that's fractured. and so we are actually looking at that sort of thing. The other thing that we're thinking about is revenue cycle management. How can artificial intelligence help us be more efficient and effective from a revenue cycle management perspective? Are there ways to deal with payers, handling denials, that sort of thing? Those are some of the low-lying fruit for early test cases. And then in terms of optimizing patient journeys, we're thinking about how do we deal with workflow, scheduling, staffing, all of those kind of considerations. And in a more broader sense, as hospitals around the United States have implemented hospital at home programs, can we leverage this technology to look at geo-mapping and a variety of things as we deploy staff in the field? And just to define hospital at home, that's where patients are receiving acute services in the home setting, something that was really championed or advanced with in the United States with COVID-19. And so it turns out it's an efficient way of care delivery. Patient satisfaction is very high. So those are just some very quick AI use cases that we're looking at within our system.
Hey, Eric, can I ask you a question?
Sure.
So when you're looking at these different pieces that or different opportunities, can you comment a little bit about the data collection and the pre-processing? Because obviously without, great data, these things are very difficult to, we'll say, hit the efficacy that we want. So what can you share on that topic?
Well, that's an excellent question. So let me use the early disease detection example. So one of the challenges you have when you're evaluating a vendor that is supplying a disease detection capability is you have to think of it in a very simple statistical sense, right? Let's use prevalence. And I'm going to use an adult example, breast cancer. So when they submit to the FDA and make a claim and say that their algorithm is performing at a certain level, they have a certain prevalence rate of that disease within their data set. So that means the negative predictive value, positive predictive value of the algorithm operates based on that prevalence rate. The challenge is, does that prevalence rate reflect what you have in your system? And if you have a lesser incidence or a much higher incidence, how does that impact that algorithm's performance? And do you need to do some pilot testing to make sure that the predictions, because if you're going to tell someone they don't have cancer, you want to really be confident that you're delivering the right message, and if they do have it. So that's just an example of how you want to optimize data. To your point, how do you deal with, there's a lot of, I think the term that a lot of data analysts use is data wrangling, in terms of how do you optimize those data sources if you have two Michael Abbotts in the system, or better yet, what we have in PEDS, if you have two patients with an acronym CPD, one could be a psychologic issue and one could be a pulmonary issue. And so how does the algorithm know the difference between those two? So you end up with coding issues. So there's a lot of data cleaning and data optimization that must happen for these algorithms to work.
Interesting. Thanks for sharing that perspective. I think we can move to the next slide. We have talked about some of the promises that AI has presented in front of us. It's also equally important to be able to talk about the risk. One key risk that was raised by the respondents of Innovaccer's survey, close to about 25% of the folks who participated, identified the potential for bias as a risk. Dr. Jackson, you mentioned about this briefly before. Uh, how have you and neighbors looking to approach this as you consider piloting, deploying new AI technologies to support providers and your support teams and consequently your patients?
Yeah, so bias can occur in a multitude of ways, and I gave one example of a sensor that may not be calibrated for all skin types. All right. I gave another example of potential prevalence of a disease in a given data set and algorithm. Another one that's worth mentioning, and this is in the social determinants of health type of health equity space, and I'll use the term, in the domain of mental health. There have been some studies that have demonstrated where if you just change the variable for ethnicity, it can have a vastly different outcome, because sometimes the algorithm exposes vulnerabilities in our systems in ways we didn't anticipate. And I'll give you an example. There was a project looking at evaluating, I think through a video camera, the behavior of a child. In one case, it recommended behavioral health therapy. In another case, it recommended incarceration. For this, and all they did was change the ethnicity. So you want to make sure that the algorithms are not promoting harms that are unintended when implemented. So you have to take that into account in terms of what you're looking at. So that's just an example of it's an extreme case, but it just shows you how it can have significant impact, particularly if that algorithm is interfacing in the criminal justice system. And they
Absolutely.
are using artificial intelligence in sentencing guidelines as a cost-saving measure
Very
on
rightly
staff.
put there, Dr. Jackson. Michael, for technologists like you and other organizations that are also building solutions, how do you think about balancing the opportunity of AI with making sure that security and privacy are also effectively measured?
Well, as I kind of mentioned before, I think, privacy and security, especially in regulated areas, is particularly important, but it's also important for companies like Apple. And that's where I think, rising technologies like confidential computing are going to become more prevalent and used across various efforts. I want to come back though to the data wrangling point that Eric made, and there was a question in the chat around what roles experts are responsible for data cleaning. The way I kind of look at it is, initially with any of these types of problems, you have a data collection kind of effort, right? So databases, APIs, sensors, and then you have some pre-processing that's required to remove noise, deal with missing value, deal with the semantic differences, as Eric pointed out, and to do maybe potentially some feature engineering. And then you have data splitting, which is like taking that corpus of data and splitting training, validation, and testing. The in terms of it's all data engineering. I mean, really. And so I think that can get embodied in a lot of different titles and a lot of different positions. I know that a lot of companies have data scientists. Those tend to be people that ask the questions more than actually build this ML pipeline. But I know from at least my experience that that upfront work on the data processing is so critical to not just get the right precision and recall, so you don't have the false positives or the false negatives correct, but also to minimize the biases. And so I think that is something that a lot of companies are realizing, that wow, like I want to go do these interesting things in AI, but my data is all over the place, and I need to pull it together. And that work, I think, is sometimes lost in terms of understanding the complexity, because without that work, then the results will certainly not be appropriate to really be deployed. So those are just some comments there. Eric, there's another comment or question that I'm kind of interested in, is around AI's role in patient safety. I don't know if you have thoughts on that, but that's I think it's an interesting. I am on the board of Thorn, which is a nonprofit focused on really helping prevent child exploitation and content around CSAM. There's a whole topic there around deep fakes, but I think what we're talking about here is maybe patient safety data. I know, Eric, if you have some thoughts.
Yeah, well, actually, there are a couple of examples that come to mind that I'm sure many people in the audience can relate to. So on the adult side, think about something as simple as, well, patient falls, right? So that's a challenge inside a healthcare system. You have someone that may undergo a procedure. they may be experiencing temporary cognitive impairment. They try to simply go to the restroom and they have a problem. So if you have artificial intelligence algorithms that are able to observe the patient in the bed and see that they actually have the capability now, I've seen this, where that surveillance technology can alert the nurse that the patient may be at risk of having a fall based on some behaviors that are being observed. In other words, patient trying to get out of bed without using the nursing call button can create an opportunity for safety. Another example, which is something that we face in a children's hospital, is the issue of elopement. Sometimes, and this is a different lens of safety, but it gets the point across. Sometimes mom and dad may not be on the best terms and may have custody disputes. And so what happens if a child is removed from the system? How can you track that and find that patient quickly? Or sometimes you have an adventurous child that may escape somehow. And so if you have AI assisted cameras and the cameras are allowed to talk to each other within the healthcare system from a security standpoint, it can be used to quickly identify the location of that child and then deploy resources to ensure the safety of that child. So that's one example on the elopement side. And then the other one is obviously clinical deterioration, using algorithms for that are constantly surveilling the second by second data that you see on the monitors at the bedside on the floor. So patients that may have early stage sepsis, you can have algorithms that can actually track that and then promote best practices in that setting. So there are many other examples, but I think artificial intelligence is a very powerful enabler on the patient safety side.
Interesting. Thanks, Dr. Jackson and Michael, for weighing in. Michael, you mentioned about training models correctly is required. Dr. Jackson, how do you think healthcare organizations can catch issues with new tools and minimize the chance of issues by evaluating the vendors' practices? Would you like to weigh in on that? Any measures that you are taking at Namers for the same?
Well, on a very basic level, we try to, and I think all institutions do this, but we look at how they're performing with other clients that have similar issues to ours. That's one way to look at it. And then also we try to, if we're talking about a large scale transformation, we want to make sure that we have a partner that's going to be around for a while. It would be tough to do all of that investment and configuration with an entity that may not be stable financially. So we want to make sure that it's an entity that will be a long-term partner, if that's what we're envisioning. We may, in terms of startup activities, may want to do more pilot level investigation and see how they're doing, rather than go all in for a large transformative effort for a healthcare system. So I'm not sure if that's exactly what you were getting at, but we look at the company's track record with other clients. We pay attention to peer-to-peer testimony, along with doing a lot of due diligence of our own, in terms of what kind of data are you accessing? Do you have the appropriate safeguards within your system to guard that data? Do you have, quite frankly, does the vendor have any ongoing lawsuits for data breaches? We look at a lot of surrogate measures and actual measures to see how that data is being managed, because a data breach would be detrimental to our mission.
Interesting. And that gives me our segue to move to the next slide, where we talk about how can one effectively navigate the AI landscape in healthcare. One of the most practical findings from our survey is summarized on this slide here. These were 5 of the top recommendations that emerged from respondents on how to navigate the AI landscape. It is an area with opportunity, but it's also quickly evolving, and so having the right fundamentals in place is really valuable for healthcare systems and their technology partners to move forward. These top five recommendations include ensuring transparent communication, choosing vendors with proven healthcare expertise, implementing end-to-end encryption. Integrated systems are preferable to point solutions, and enforcing strict access controls. I'd love for both of you here to speak to your experiences on some of these points mentioned here. Dr. Jackson, if I can ask you about the first two, ensuring transparent communication and choosing vendors with proven healthcare expertise. If you could weigh on these two pointers and your experience, that would be great for our audience.
Sure. Well, by transparent communication, do they mean within the system or do they mean outside the system?
They mean within the system.
Yes, okay, I mean, absolutely. And in particular, in our case, because we are located in 4 states, 95 locations. And so we have to spend significant amount of energy, and we have a what we call the More is Now internal communication platform, which allows us to transmit information to all our key stakeholders. But with any project, in terms of best practice, you want to have robust communications with all team members, with all stakeholders, and also give them an opportunity to provide that bi-directional is what I'm getting at, communication. In terms, I think we kind of addressed the vendor selection piece. I will speak from the lens of pediatrics. We are not always convinced because you can do it in an adult, you can do it with pediatrics for one of the reasons I mentioned. The acronyms may be the same, but the meaning of the acronym may be different. And so, so if we see successes on the adult side, and we have limited vendor availability capabilities on the pediatric side, then we really want to partner with them in robust ways to ensure that the pediatric issues are elevated and addressed, and that the performance is happening as it should. So those are some of the things that so that's and obviously we look for robust pediatric experience whenever possible.
Interesting. Thanks for sharing, Dr. Jackson. Michael, weighing on the technical aspect of this, about end-to-end encryption, integrated systems, and enforcing strict access controls, what is your viewpoint, and how do you think are these the right measures while effectively navigating the AI landscape?
Well, I mean, I think it comes like down to like what you mean by navigating AI landscape. Presumably, it's like looking at different vendors. I think there's obviously a huge security kind of auditing component for any of these companies that you're looking at using, and there's certainly best practices. I mean that should be applied, right? Whether it be, as I mentioned before, really respecting patient privacy, and how do you ensure not just HIPAA compliance, but also just maintaining that trust with users. And so, I mean, I from my vantage point, like especially 3 and 5, like that should be like bare minimum what folks are doing. I think there's another piece here that maybe it would make sense is like number 6 or 7, which is, can you explain why certain recommendations are coming out of the system or not? And that explainability, I think, is particularly important, especially in light of the application in an area where it has an impact on people's lives. And so I think it's an area that a number of companies are working on, but I think that's particularly important as you navigate it. I think when you look at different vendors, I'm sure, again, they have a great story on pen testing from a security perspective and whatnot. But I think really understanding, how they kind of handle their patient data and what's their posture is critical. Because as soon as you go and obviously leverage a vendor, as Eric pointed out, you are by extension kind of related to any issues that they may encounter, whether it be a breach or whatnot. So I think there's a very high bar here, and I think it's frankly probably one of the reasons why there's a lot of efforts in public clouds to work with healthcare companies because they have very well established security teams and practices, and frankly, they can manage security teams and then recruit teams that are just much bigger than a lot of companies in the healthcare space, frankly.
Interesting. Thanks. And thanks for also sharing the other two pointers that you rightly mentioned would be equally important, if not more. Um, that wraps it up. We'll jump to the question and answers very shortly. But before that, if any of the attendees here would like to get on a call with our health AI experts, you can scan this QR code and be able to book a call with us. Just allow me 2 minutes to get the questions in place, and then we can quickly jump into the Q&A and direct those questions to our speakers.
While you're doing that, though, I think we've actually covered some of the questions, but Eric, it'd be interesting for me to hear from you on one of the questions is what should healthcare organizations be mindful of when selecting AI capabilities to implement with patient-facing care management? We talked a little about that in the last slide, but I don't know if you have additional thoughts from a customer perspective of considerations that you have that we haven't covered.
Yeah, well, one area of concern, it's a very basic one. The healthcare space is highly regulated. And I'm gonna openly admit I'm giving some editorial here, but I think my colleagues around the country would agree with me. A lot of when you're inside of a healthcare system, all the physicians and nurses, all the providers are subjected to mandatory activities on an annual basis, compliance related stuff. And because it's mandatory, it's not necessarily user friendly. And that seeps into culture more broadly. So what I think about with patient facing material, how do we make sure that it's extremely user friendly, right? How do we make sure the patient doesn't have to log in? I'm just going to make this up, 15 passwords to get access to something. How do we make certain that they don't have to have many clicks to get to their final destination? How do we make that experience extremely easy? So the digital front door, how do we make those processes smooth? So a lot of times you have to study, to use your example, what is Apple doing, with this customer interface, and how do we create processes where I would argue not to diatribe too much, but I'll be very quick here. If you look at some companies like Johnson and Johnson, I know we agreed to stay away from brands, but I'll just use this for a minute. They have documents going back to 1945 or somewhere in that neighborhood of fundamental principles that they believe in, their core beliefs. And when they negotiate a contract, they whip out those core beliefs and make sure they're not departing from it. I would love to have a core belief that says must be easy to use. Now, what does that definition mean? Easy, but if that is our North Star, with all the security concerns and everything else, I think we may find something special. It's a cultural phenomenon, but if it's a goal, that would help. I think the electronic medical record deployment for clinical staff early on, and even currently, is really tough. It really created a tremendous burden. We barely were able to look at the patient. We had so much compliance documentation. Now with ambient listening technology and so forth, we have potential opportunities to decrease that burden of clinical documentation. But I believe our North Star should be ease of use for the patients and the providers.
I'm gonna try jumping in again. Thank you, Rishita, for jumping in through all this time. Can you all hear me now?
Yes.
Yeah, great. Yeah, the internet connection seems to be alive and well as we approach the end of this. I've been able to listen through almost all this and really appreciating all these insights. I think to your point, Dr. Jackson, it really rings true for myself. as someone who has an upbringing in consumer-facing technology and other industries, it does feel like organizations can sometimes be caught up in how do we make sure we follow the letter of the law, but that can sometimes get in the way of the spirit of the law. So I think it's a really great insight. I'll maybe call out one other question that I see on the list that's kind of a big one and an interesting one. It says here, based on current trends and expert predictions, what are the top 2 or 3 operational challenges facing healthcare organizations in 2025 that offer the highest potential return on investment when addressed with advanced AI solutions? So maybe, Dr. Jackson, if I can put you on the spot, you've been spending a lot of time in the last year thinking about what opportunities are the biggest for your organization and what's been panning out, what's not been panning out. I'd love to hear your thoughts on what are some of those big things that you think there is a lot of opportunity, and on the flip side, are there any where you think there's still a ways to go for AI to be deployed successfully and safely?
Well, I think one of the conundrums all health systems have, and I've visited health systems around the world, is workflow, throughput. Those are really challenging things. And I'll just to give you an example. If you want to simply decide nursing to bed ratios on a given day, a lot of times those are manual based processes that take days or many, many hours for the folks to work out vacation, PTO, all of those kind of things. So AI having the ability to help sort that out is helpful. Not to mention the fact acuity levels. So in other words, you may have a junior, I'll use an example, a junior nurse. What kind of beds do you want that person to cover versus an experienced nurse? How many are available on a given day? You can see how dynamic that is. So having artificial intelligence on that side, I think, would help with a phenomenon that we call provider wellness in terms of getting there, because providers are leaving the field because of the work conditions. And so AI has tremendous promise to help assist with that. So that's one issue. In terms of revenue, clearly, as I mentioned, I'll use one example, denial letters, right? So unfortunately, in the United States, we have this process where a lot of, I won't get into all the news, but we have some examples of payers maybe having 30% rejection rates on first pass, or claims or whatever. And so having AI assisted responses to denial letters can take processes that take hours to like minutes with high succession rates because they can do trending and predictive analysis and actually that helps a patient because it decreases time to event in terms of the care that they deserve. So those are just some of the operational issues. There is a domain that we need to remember, be mindful of. Telemedicine, telehealth is another big area where this technology has tremendous value. For example, remote patient monitoring has decreased cardiac mortality by 40% in pediatrics for patients with congenital heart disease. So being able to monitor patients in the home who may have significant diseases like cardiac, pulmonary, whatever, extends the capabilities of a brick and mortar structure. And
That's very impressive. You hit on a lot of things. I'm going to recap it quickly, make sure.
Yeah, I'll be more.
No, that's great. Yeah, so you talked about workflow and throughput, and I think it's absolutely spot on that there are some operational processes where there's a lot of data to manage how to optimize people or how to optimize systems, and it's things that computers are very well suited for. And to your point, that some things that can take hours or days can become near instantaneous. It's a big winner. I think to your point about provider wellness, I mean, that's one of the things I think that we highlighted even early on in this discussion about one of the wins that we've already seen in 2024, to the extent that automation of documentation, simplifying of handling the EHRs can take some of that load off, bring down the cognitive burden that can help with that provider wellness. And to your point about revenue and some of these targeted wins across domains, that's great. I'll move to another question I see on the list here. What roles or experts are responsible for data cleaning? So I think this was brought up quite a while ago in the discussion. I'll generalize it just a little bit. Dr. Jackson, you had brought up earlier ways that you approach how to evaluate vendors and how to run pilots in order to be able to maximize chance of success. And Michael, you spoke about some of the capabilities that vendors should be, when they're building it, should be focusing on in terms of how to train models accurately, how to minimize the chance of problems. I'd love, Michael, if you could just spend maybe a few more minutes and talk a little bit about how you imagine people in this audience, people who are trying to deploy things at their health systems, how they could assess vendor companies, to judge whether they're taking the right steps to be able to train models correctly and build, systems, the white box approach you had talked about, and so on.
Yeah, I think that, we talked a little bit about this already, but I think there's some, kind of basic questions that I think any vendor needs to be able to answer, whether it be how they handle patient data or whatever the data. And then that handling is not just storing and encrypted, it's how you are processing it, how do you remove bias, things that we kind of spoke about. So I think there's a security dimension broadly. There's a kind of set of questions in AI, like I mentioned at the beginning, around evaluation. And that really comes down to understanding how good or not good a particular model is for a particular product or service. And but I think actually Eric hit a number of these that were like that really good, of like looking at for their customers, like etc. There's different ways that you can kind of aggregate the same way you look at any other vendor from an acquisition perspective.
That makes a lot of sense.
Hey, Kavi, can I make one point on that?
Of course. Yeah, please do.
And I'll be very succinct. One of the challenges that we have, it's a very significant challenge, and it was published in the New England Journal of Medicine. I forgot the title of the article, but the spirit of the title was it reviewed formulas that were used to calculate things like GFR, a glomerular filtration rate. These are ways to determine if somebody needs to get a transplant, how their kidneys are working. And there's a phenomenon known as eGFR. And then there were, vaginal birth after C-section, predicting whether or not someone should go for a C-section versus a natural birth. The problem is a lot of those algorithms had ethnicity baked in and ended up promoting inappropriate procedures or made inappropriate assumptions. The problem is that if you are an algorithm developer and you're referencing what you believe to be an appropriate algorithm because it's endorsed by the American College of Obstetrics, you have no way of knowing how faulty that is. And so the New England Journal article addressed the fact that when you take those formulas apart and adjust for variables like race, it turned out that if you inserted insurance or marital status, it had an equal effect in some cases. So then the question was, well, why were they using race in the first place? And so these are some of the hazards that are just baked in that we have to deal with. And so there has to be an alliance with the developer and healthcare expertise in that development process. And you have to be very careful when you have algorithms working, because some of the assumptions in there may be faulty even though they may have been used for decades.
Yeah, it's a great point. It's a little bit chilling to hear some of these stories, but I think your point calls to light that this is an evolving space. And it's not going to be something where it works perfectly out of the box in all cases on day one. And so choosing the right partners, with the right backing, to your point, Dr. Jackson, earlier about, a long-term partnership, doing your vetting beforehand, and to the points Michael's raised throughout this discussion about what the technology company ought to be doing in order to iteratively improve and minimize the chance of these issues, or at least addressing them once they're discovered. Seems very important. Let's see. Are there any other questions we didn't hit up yet still relevant? I guess maybe I'll do one last one. I think we can wrap up because we've only got a couple minutes left. There is a comment here, which isn't necessarily a question, but says easy, safe, and focused on outcomes, not built primarily for building. So I think that comment was a reference to revenue management. But maybe I'll generalize it just for a moment and think about, are there ways, and this is a question for either of you, if you want to jump in, are there ways that you would suggest for healthcare systems to think about how to choose outcomes and how to judge success towards those outcomes for some of these new AI technologies?
Well, I can go first on that. I know I made some negative comments. Let me end on promise. One area where artificial intelligence, and aligns with your question, Kabi, is clinical decision making. So let's say I have a patient in the ICU that is early stage cancer workup, but I'm not quite sure it is cancer. It turns out that before you get the oncology consult, the intensivist with a cognitive aid can optimize the tests that need to be ordered early on. It's hard for a human being to keep track of the various latest suggestions in a timely way, believe it or not. There's a biology constraint. And so having a cognitive aid in the form of AI that makes suggestions, if this is leukemia workup, here are some of the things that could really help you. I'm not talking about stuff that you do every day. I'm talking about the zebra chasing that has to go on sometimes. And it really helps the oncology team because those things are already in motion. And so I think the clinical decision making is a major opportunity for artificial intelligence, because there's so much a human being has to consume to stay on top of that kind of assistance with optimized lab orders and stuff can really be a major benefit and cost saving.
Yeah, that's a great call out. Any final words you want to add, Michael, or?
No, I think Eric hit it great.
Yeah. All right. Thank you so much for both of you. Really enjoyed this discussion. Thank you for everyone who's joined this call. We're very happy to have you. We're going to throw up a feedback form. I think it's popped up already for everyone who's on this call. It takes only about 30 seconds, just 2 questions. So we'd love for you to give this feedback, and that can make sure that as we hold more sessions in the future, we'll hear you and make sure we're hitting topics as well as possible. Once again, thank you so much, and have a great day.